About 25 years ago, I was a mom with 3 kids, a cat, a mortgage, a so-so job, and I decided to become a physician assistant. So I put in my application knowing full well they would never take me, and in the meantime decided to go to nursing program. Well, at the end of the first quarter of nursing, I got this crazy letter saying I had been accepted to Stanford. So I knew they'd made a mistake, but I thought I'm gonna sail it out. I'm gonna do it until they catch it, until they see they picked up the wrong envelope. Went to school, made it through every quarter, looking over my shoulder. They never caught it. I became a physician assistant in family practice with a wonderful supervising physician who had vast experience, emergency room, architect, and family practice doctor. He was great. And he had given me one of his patients who was quite stable, although elderly. He thought that would be a good patient for me to follow, and I had seen her 2 or 3 times, and Ruby was one of these impeccably dressed, classy 83-year-old women who come in always looking like they're out for a social occasion. Because for a lot of patients, going to the doctor is a social occasion. Don't forget that. So on this one visit, with her 2 daughters who always accompanied her, sitting primly, perfect posture, sitting up on the exam table, I asked her how she had been since her last visit, and she goes, "Oh, you know me, I'm always fine." She goes, "You know, if I could just hear better, I think my life would be perfect." And I said, "Well, how long have you had trouble hearing?" She goes, "Oh, at least 5 years. You know, the doctors just said this comes with old age and I need to accept it. And my husband had, when he was alive, had such torment from his hearing aid, it tormented me. I just don't want a hearing aid." And I go, "Well, since everything else is going well, let's take a look. Let's look in your ears, see if there's anything that shows up." Well, it didn't take more than 10 or 15 seconds. I only had to get close to her with the naked eye to see she had dirt or whatever coming all the way out to the out part of her ear on both sides. I said, "Well, at least let's get this out of the way and then see if you can hear better without this in your ear." I checked with my supervising physician. I said, "This is gonna take an hour. Can I take an hour and just work on it with my medical assistant?" He said, "Yes, I'll come get you if I need you." So I'm a medical assistant and I went to work. One of those big 20 cc syringes with a little butterfly on the end, you know, under pressure, cleaning the ear, draining the ear, cleaning the ear. I kept looking over at my patient, kept saying, "Let me know if I'm hurting you. This can get uncomfortable. Let me know if you're dizzy." And I'd look at her and I'd work some more and I'd look at her, and we were making very good progress. And I looked over at her to check on her. Oh boy, tears were coming down her face, and I thought, oh, I've hurt her and she's embarrassed to say anything. I said, "Ruby, I'm so sorry, am I hurting you?" And she looked at me and she said, "No, I can hear for the first time in 5 years." Well, if that wasn't a moment I knew I loved what I did, I don't know what is. So it's such a simple thing. Her telling me there's just one thing that would make my life better. So I think if I had a message for all of you, it would be, if you haven't found that you love what you do yet, or you're not sure if you love what you do, maybe you need to be asking your coworker, your patient, anybody, your family, is there one thing I could do for you today that would make your day better, make your life better? And sometimes that's all it takes to find something you really love to do. Thank you.